Read the case of acromioclavicular joint disruption. It's 10 days old. It's type 3. It's a young boy of 26 years. Right dominating hand. You can see 100% displacement over here. So we'll go with open technique. Right now you can see that we have the this is the acromion, lateral end of the acromion, angle of the acromion, and then this is clavicle, lateral end of the clavicle. You can see that it's prominent on the superiorly, and this one is the bark area for the coracoid process. So we're going to use the NCN from coracoid to the level of the clavicle. It's a relatively curvilinear NCN in the. So it's around 3.5 and 4 centimeter NCN from the tip of the coracoid process to the clavicle mid level. So we open the skin and subcutaneous tissue, and before that we have injected the diluted adrenaline. Okay.
Yes, sir.
Instead of splitting the deltoid fiber, we will detach the subperiosteal, deltoid and trapezius on either side, and we'll use that flap to reach the clavicle and coracoid process. Okay. So we retracted subperiosteally the deltoid muscle from there, and we exposed the coracoid process, and right now I am over the base of the coracoid process. Just to put the one homen on the medial side, it should be for the safety of the musculocutaneous nerve, and on the one on the lateral side at the base. If I can slide it down, it's just next to the base. So I drill first, I put the wire, and then reamed over 4 mm, and this is 2.5 mm bit, so it's passing freely down. So I drill it first, and then I'll address the clavicle to make a hole over there. Okay. I have removed the thread on the coracoid process. I'll pass it down to the coracoid and flip it to its on, and then I will drill the clavicle, and I will pull it out from the clavicular hole, and then we will fix the joint. इससे चला जाती है
ये वो नॉट पुशर है सर,
ये उसको पुश में करके लेके जाएगा नीचे।
ये सही है। इमेज में एक्सरे।
We did the retrospective pull of the button from down to up in the clavicle, and through these two threads, and these are the we have already passed under the coracoid process, and now we came out of the clavicle, and right now we're going to remove this thread, and we will fix with this deltoid and trapezius with the fiber wire, and we took few of the stitches deep to the endobutton over here, and one stitch over what we have reconstruct the acromioclavicular and repaired the deltoid and trapezius on anterior and posterior side. Now we'll put few of the subcutaneous and then the skin stitches. So one button is over here, it's transverse, and the other one is anteroposterior, so it's been there. So it's been nicely reduced acromioclavicular joint. So what we additionally done, this is the substitute of the coracoid ligament, and here we fix it with the fiber wire on either side. So if you see right now, the disc has been there, so the joint is congruent and well reduced. So we will protect it for 4 to 6 weeks.